Hi, Dr. Tina Wang. We are so excited to have you in this interview, this special day that we have at Fascia Research Congress. I can feel all the excitement bubbling in our conference, all of these brilliant minds together in New Orleans for this conference. And I invited you on to talk with me today because you are one of the most brilliant minds that I know out in the fascia world, and especially with your experience with EDS and hypermobility. Thank you.
Thank you. Such kind words. And I'm so honored to be here. Thank you for putting this podcast together and having this really important conversation.
Yes, we need to have our voices heard, right? In this field, especially when it comes to Ehlers-Danlos and some of the lack of awareness that has been current with the way, I guess, patients are dismissed a lot of times or underdiagnosed. So when we have people who are really advocating for EDS in the field and also pushing that edge of research and getting awareness out there, that's what we need. We need more of you.
Right. Well, thank you. And this collaboration, this gathering of different minds, different backgrounds, this is really where new magical things happen.
Yes.
And there oftentimes can be friction, but it's in that friction that new ways of thinking, new ways of doing things start to form, new conversations.
Yes. Tell me more about this, because I missed the first day of conference. So my daughter started school. Her first day of school was yesterday. So I got her to school, rushed over here and started. And immediately I was taken aback by what you're just talking about right now. This like magical soup of conversations going on and thought processes happening. And here we are, we're all asking questions. At this, we have a lot of knowledge, each one of us carrying that, but we're all asking, these really cool questions that we want to know more. And it's very intriguing to see what comes out of those conversations.
Yeah, from the prior congresses, we heard the attendees, we heard the membership say, we want more collaboration, we want more intermixing, we want chances to learn from each other. So the board and the organizing committee and team really worked hard to design programming that allow that mixture and conversation. And so the program this year is extremely rich with different types of learning sessions, so that everyone can experience things from a different way. Even your traditional scientific abstracts that are really dry. Mm-hmm. And it's classic. It's the way things are done.
Yeah.
And you get to see scientists butt heads.
Yeah.
It can get really contentious. And I have to tell people who are not from scientific backgrounds, this is science culture.
Yeah.
And then you go into a movement session.
Yeah.
And the scientists, the medical doctors, I'm in a suit. I've got to move. And then you can move into your more classic educational sessions, like let me show you my ideas, let me show you my research, let me show you the translations. And then we have the discussion groups where you get together and you can clash. Or you can share your patient experience, your clinical experience, mm-hmm. your research frustrations.
Yes.
Discuss translation. Disagree about things.
Yes.
And then move into networking and continue there and into dinner over drinks. Really, in the mornings, get up. There's movement.
Yeah.
Stretching, manual therapy. So it's really designed to try to meet the learning and collaborative needs of people of all backgrounds, even people who are experiencing life as patients, like we are.
Yes, and I loved that approach. It definitely came off in sessions of, I would have to kind of like take a little mental note real quick of, this is an audience of clinicians, researchers, scientists, and patient experiences that we're walking through together. And the way you just described conference, it made me think of fascia. It literally made me think of like the dynamics of fascia, living, breathing, moving, changing as we go. So it just gives me chill bumps actually, kind of, because we're all like, mesmerized, right, by this biology and physiology of fascia. But metaphorically, this conference is like a big fascia field.
Yes. Yes, even I have the privilege of serving on the fascia nomenclature committee, and even that conversation is, how do we reflect that histologically? How do we reflect that in the description and definition of the tissue?
Yes.
And how do we then communicate this? Because it's about language. And we might be speaking about the same structure, but seeing it from a different point of view.
Yes.
Different words. And that's the challenge here, is especially with Ehlers-Danlos and when we're looking at this complex illness.
Yeah.
And even I come on to this EDS community and say, no, this is a fascia-based disorder. Oh, is it? Now, that's even another conversation, because you and I, as fashionistas,
Yes.
fascia enthusiasts, fascia scientists, clinicians, we think, of course, and that's what I tell everyone, of course it is.
Yes.
But you have to actually prove it.
Right.
And explain that. And that's a challenge too.
Totally. We're not quite there yet where the language really speaks to the fascia. And because it's a global community here, even in the conference, and it's an international, interdisciplinary team of sorting out. So language is really important. And I would love to pick your brain, like, how do we get there? We just keep doing this kind of stuff, right?
Yeah.
Over time.
Yeah. I think collaboration.
Yeah.
And that's one of the real, I think, important experiences as your kiddos' first day of school.
Yeah.
And the emotions and the friction and the new experiences.
Yeah.
And my kiddos, and then for ourselves too. Oh, I am so uncomfortable. What is that person doing right there with that movement? I'm so uncomfortable. And then going into a scientific session from the other point of view as a movement specialist.
Yes.
What are they saying? What is a fibroblast in the extracellular matrix and the IL-6 and a cytokine? Good, you should feel uncomfortable because that means you're growing.
Yeah, that's a great point.
Yeah, and these are intense days. We travel in. We're coming in from different time zones. So it's an experience where our outer shell starts to fizzle because we're vulnerable. And then you come into this vulnerable learning experience where your DPT, your MD, all of that starts to slough off.
Yep.
And you come in really vulnerable, really raw, feeling really uncomfortable. And what we want to do here is make it safe. Like, I know you feel that. That's okay.
Yeah.
That's why we're here.
That is great. That is such a great, meaningful way to approach learning. And how, now that occurs to me, how vulnerable our patients feel when they are so uncomfortable and they've walked through all their experiences, in addition to the layers of not being heard, not being seen, going to doctors that they're seeking answers with and not having any, and how that cracks your shell open.
Yeah, it's so hard. It's systemic.
Yep.
The oppression is systemic for the healthcare providers.
Yes.
For the patients, for even the healthcare delivery, the payment systems, what's exchanged, the socioeconomics.
Yep.
And so I know there's so much hurt and trauma for us as providers, for the patients. And I encourage our patient population to really understand that it's collective trauma, even for that really nasty experience that is not right, that is not justifiable.
Right.
To really understand that when you walk in, it's collective, that physician that is doing that gaslighting has also experienced the same type of trauma within that same system. And so really accessing good care means being grounded, knowing what you want, knowing where you're going, and finding really amazing providers like you, starting that trust, because that's the foundation, is the trust in that one person who then helps you anchor and form a team that starts to move you in a direction towards health, whatever that looks like for you as an individual. You can't look at other people and say, oh, I want to be like her, or I want to be like that. You can say, that's where I'm going. What's the team that's going to slowly help me get there?
Yes, because everyone's journey is so individualized. And I think what you just said is very beautiful because it helps us to see each other's perspectives more. And to not, it kind of takes the animosity out of the process a little bit. I don't know, there's a better word for it, but it takes that hurt out of it a little bit to understand that, like, we have so many medical professionals who are in burnout and they're functioning in their sympathetic nervous system at work. And we're all like, I try to encourage my PT students or PTs in training, take that deep breath in between patients, ground yourself, do something, that helps reset your own nervous system, because your nervous system is coming in to be open and create a safe space for that patient in front of you. And what you just told our audience with our patients who are listening is how to advocate and be that grounded and safe space within themselves. And it really helps them tap into what they need.
Right.
Love that.
Yeah. And you bring up this really important point, is we have so much burnout as providers who treat for this population because it can often be devastating for us. I often have to remind our patients, sometimes being better means not getting worse.
Yes.
Or slowing down the process of getting worse.
Yes, absolutely.
And that's hard. It's hard for the patient to process, and it's hard for us when we go in, because as perfectionists, we feel like failures every time we can't save a patient, but that's not our role.
Right.
Our role really is to, because it's so systemic, so broad, it's just to walk that journey with our patients, help them problem solve.
Yep.
There's nothing else there. There's no magic. There's no magic Prolo. There's no magic pill. There's no magic PT. There's no magic vagal stimulator. No,
you're right.
There's no magic.
No silver bullet, we say.
No. It's really a journey that we walk together with our patients.
Yes, absolutely. I'll share this. My primary care provider, when I was in her office earlier this year and I was having symptoms of perimenopause, and she goes, we're in this together.
Oh my goodness. What a wonderful physician. And that's it. And it's so hard because in medical school, I teach residents too, and you teach physical therapy students, and we have to teach them the medicine.
Yes.
You have to drill it. You drill it, you drill it, and then you turn around because they have to have competency, and then that's not medicine, though.
Right. Those soft skills
are the most important ones.
Yes, absolutely.
With your patient, being hearing them.
Yeah.
Because what you deliver may not actually be the right
protocol, treatment.
Or, high velocity, low velocity,
right.
gabapentin, nortriptyline, which it's what is it that you need right now?
Yeah.
And it might be just to have 10 minutes on the table in quiet time together.
Yeah, feeling understood.
Being heard. That's it.
Those are huge. They break down those barriers. I feel like when a patient walks out and they feel seen and understood, they're really empowered by that process then. And like you said, the trust is there. And, I keep circling back to our EDS. They're my babies in my clinic. I love them so dearly. And they're so fragile. And so to hold that fragile person in a safe space and to just validate their experience with good listening, we are at a level where your clinician skills and your foundation and medical background and training, all that, it's like it speaks for itself, like that's the way that we carry that automatically in our toolkits, I feel like, when we have good training.
Yes.
And then it's like you said, the attention and awareness you bring in to their story.
That's the art. The art to be able to access those parts of your brain simultaneously. Okay, I'm thinking about differential diagnosis and how to move forward, and I'm being present, and I'm listening.
Yeah.
And I'm not letting that part drive. I'm feeling the patient and where they are, where they want to move. And today is not the day. Today might be the day to, hey, are you today, would you like to consider a medication? No? Okay, that's okay.
Right.
What is it that you need today?
Yeah, the softer side. Yeah. That's beautiful. I also want to ask you, because I want to acknowledge that this is hard work for providers, right? It's like when we give that bandwidth and that capacity from our hearts, we ourselves can get into caregiver burnout and caregiver fatigue, compassion fatigue, all the labels we put on that. And so what do you do for yourself to charge your own battery back up again?
Yeah, I am a very serious yoga practitioner, so extremely serious, and it's a big part of my life.
Yeah.
Is the meditation, the breath, the
Beautiful.
movement, the mindfulness. It's not the only way to access that centerness. Mm-hmm. Proper eating, proper food.
Yep.
Who you connect with, the choices you make on a daily basis on who gets to come into your space. So that does mean I limit my patient load.
Yes.
And I'm not going to be famous and running big clinics with people coming through, because that's no longer being true to the type of provider I want to be.
Absolutely.
And that means limitation in resources.
Yeah. I've always said you can't have high volume and high quality in our system. They don't exist together.
I think in materiality, in reality, right?
Yeah.
It doesn't, even if we said, okay, I'll see patients for free, how are you going to see 16 patients with this complexity a day?
Right.
Even when you see 2 to 3,
your
brain is exploding.
Yes.
And I'm sure you're like me, where you think about the case all day long, and we carry our patients with us.
We do.
And so even if you have a load of 2 or 3 a day, this goes on. And I have numerous hats. I'm also an academic physician, where I see bread and butter PM&R, and I do the pain injections. And it's so refreshing. I can walk in and say, today I get to see 16 basic patients a day and do basic things.
Yes, right.
And then the next day, okay, now, today is complex medicine day.
Taking everything of you to operate that.
Right.
Yeah, totally. Yeah. Oh my God. I love it that we're, all of us collectively, discovering how to have that capacity right? Like to have those, to carry compassion and to have patience in our hearts. And then also to be like, okay, I have to have a boundary, draw back here. I need to like hibernate or do my yoga and my mind body medicine. And, you know, I've had times in my life earlier on in my PT career where I had burnout pretty badly in a hospital system. And I had to learn the hard way of how important it is to regenerate and recover and fill my cup back up and find those things, you know, as we grow, those things can change. But when we need to be able to take our own medicine and save time for that. So it's a real balancing act.
Yeah. And it's the same for our patients as it is for ourselves.
Yeah. Absolutely.
We're in this materiality and everything is finite. And so we really have to be able to set firm boundaries that are compassionate and kind and recognize that we're all hurting.
Yeah, right. I love that. I want to ask you one last question. What are you most looking forward to in this conference? I know we're kind of like halfway through at this point, but is there anything else that's like on top of your mind where you're like, I can't wait to experience this?
Oh my goodness, what a loaded question. I have so much I want to do with FRS. I want to push fascia education into the formal clinical space. So what does that look like? And those are long-term strategic goals.
Yeah.
And so all the proceeds from this conference are going to go to supporting these type of efforts, but more locally and short term. I want people like you who are coming into this conference, our presenters and our non-presenters, to speak, to be heard, to be inspired, and to have the next new generation of research and science and clinical translation coming out, not just the keynotes on the stage, not just the big names that we've heard, but the new generation. I want you all to have a voice and to grow out of this nursery that we've created.
That's a beautiful way to put it too. The way that we can innovate together and push that and use our dreams and passions together, having the voice, and like you stated so eloquently, everyone feeling like we're a little uncomfortable, but we're here together. We're learning together. We're doing it together. And I love that comes through in your mission and what you've talked about with me, that you're really creating that as you go. That's awesome. Thank you so much for everything that you do, Dr. Tina Wang.
Thank you so much for everything you do. Thank you for having me today.